Prior to the team was put together, the rehabilitation was based on one ward alone at QAQM, and anybody who had rehabilitation needs had to go to that ward to have their input. So clearly a lot of patients on other wards missed out.
We needed to look at a new way of working because we were moving from covering one ward to 5 areas. So we decided that the best way to move forward would be to make our team generic, so that meant everyone in the team is able to see patients from an OT and a physio point of view. Previously, if a patient came into hospital, they would perhaps come in through CDU and they would see a physio and an occupational therapist who might do their assessments. If they needed admitting, they'd then be moved onto a medical ward where they would see a different physio and a different OT. And then they'd be facilitated through to discharge. Under the new system, my team sees them right the way through from admission through to discharge. So they'll see one of us at the point of admission and we'll do all their assessments. So there's no repetition of assessments and there's more continuity, so they get to know us better.
With planning the discharges for our patients, we now try to have very a timely EDD, the estimated date of discharge for our patients, which are linked very much with the therapists. And the fact we've got this one referral service makes it so much easier to do. It saves time and ultimately that means patients can be discharged home quicker, which is very good for them.
So, anybody got any questions on that? Anybody done?
My team, and there's 5 of them, plus myself, are responsible for all the learning and development and leadership opportunities and development within the Trust. Several years ago now, we started very slowly and took on 1 or 2 apprentices. And they did really well, and they're still working in the organisation now and in Band 2, Band 3 roles. So we thought this year we would expand it, and we've now got something like 30 apprentices working in the Trust. We have got 10 or so that are working in business admin currently, with another 10 about to start now. And then we've got another 10 who are working in the pathology department, and we think that we're one of the first trusts ever to have got apprentices working in pathology, training to be assistants in biomedical science. It's really exciting to be able to see people develop. I know people who've gone off to university because they've had the opportunities to get some GCSEs, which they hadn't got before. We've also got other people who've gone on to do degree level courses in management and leadership, which I think then adds to the Trust's competencies to be able to grow the right people in the right places at the right time so that they can then progress and develop.
Hello there, very pleased to meet you. My name's Lisa Debono.
Lisa started in 2009. She was a senior scrub nurse, but this was a completely new role for her. So initially she needed to shadow me in the clinics as to what we do, how we review the patients, how we examine the patients, and then how we prepare them for surgery, and then she would assist me in theatres.
I've been a registered nurse and I had my diploma in theatre practice, but I had to enhance those qualifications with doing my degree in clinical practice, which I undertook at Greenwich.
As she grew in confidence, improved her stature, then we gradually built into her role all these added bits, what she's currently doing.
All of Mr. Basu's elective surgical patients will be followed up by me on the telephone, and that will save them coming back into clinic just to tell us that they're pleased that they've had their operation, that they're feeling better, that their wounds have healed. These are all the things that I can ask them on the telephone and save them a journey into the hospital where they need to take time off, park, etc., and wait for a short appointment time in what could be a lengthy clinic.
And then after this, we started thinking of setting up independent clinics for her. And this we started with the gallbladder clinics. Again, we developed the protocol and we set the guidelines, and she started seeing these new patients simultaneously in the same Monday clinic. The international world recognizes the role of the surgical care practitioner, and which Lisa has very nicely fulfilled for the Trust, making a huge difference to the patient and to the working pattern of our specialty in the department.